Good afternoon, everyone. This is Idalis Bailey from Global Integral Beauty. We are here to enjoy our annual meeting. This is our homework every month. Yesterday we did in Spanish, and today we have a wonderful VIP speaker. They are international. They have amazing experience. We like to learn from them today a little bit about the surgical and non-surgical facelift. As you know, everyone is talking today like facial harmonization, facial skin rejuvenation, technology, facelifts, everything. Everyone who don't know me, my name is Idalis Bailey. As you know, more than 19 year experience, registered nurse, MBA in marketing, skincare specialist in global integral beauty too, author, bestseller, 3 edition. Yes, 3 edition with a global expert in integral beauty book. International speaker in marketing and aesthetic too, and also we have the podcast and the interview has time with Idalis. How do you approach multidisciplinary work in a team to help her to get the best result?
Sure. I think, with us, we usually, do like an initial consult, an assessment, almost like a holistic, of patients, not necessarily medical history, but maybe like the skin condition, but also aesthetic goals and where he or she is in her life and lifestyle, what her immediate needs are. Given her age in early 50s, she could be ideal patient for, facelift, and I'll let Dr. Michael speak to it better. It doesn't have to be a full facelift, maybe just a mid facelift, but the facelift will obviously address the sagginess and skin laxity to a certain level. But I think it's very important to look at the aspects of skin health and also the condition of her skin. So this is where topical skin solutions will come in. I feel like there's an integrative approach to treatments nowadays at med spa level, at plastic surgery level, dermatologist level. It's not enough to just go for a quick, immediate gratification treatment. I think it's the holistic approach of, obviously when it comes to diet, lifestyle, but also what she applies topically on the skin. So when it comes to the concerns that she's facing, we would definitely recommend products with actives such as peptides, but as skin messengers that will help maybe, with the skin laxity, so retinols, vitamin C products, because we know that these ingredients have been clinically proven to have meaningful action in the skin to help maybe collagen production, induce collagen production, to help the quality and texture of the skin. It's not enough just to get perhaps a facelift, because if you have discolored skin or pigmented skin which doesn't reflect light, it's not glowing, the facelift will only get you, to certain, goal. I think you have to look at the entire canvas and how it all kind of lives together. So for me, it would be more integrated approach, recommending the patient to obviously get on a pre-procedure skincare regimen and then maintenance regimen after the procedure, and probably have her see a plastic surgeon for consultation. In between probably facelifts, in order to maintain the results of a facelift, we would recommend, regular visits to estheticians for facials, for chemical peels, laser treatments, things of that nature. And then we have a whole gamut of skincare products, even within topical skin portfolio, that can help complement the procedures and support skin health and wellness in between. So that would be kind of like my approach. It wouldn't be just one stop shop solution for skincare, because obviously skincare, it can only do that much correctiveness. I think being proactive about healthy skin and maybe taking antioxidants and applying antioxidants to skin will help prolong the health and wellness of the skin and vitality of the skin. And also taking care of the skin barrier, because with an intact skin barrier, none of the things that you put on the skin will penetrate or have action. So that would be like my 3 cents.
Okay, so interesting answers, and I love the panel, Idalis. You did a perfect job, right? Because this is exactly what I deal with every single day when I'm talking to patients. I have to address the psychological standpoint of it. I have to address the patient from the outside in. We're talking skin down to the structural features, and then into the mental and emotional features, why they're there. And Ewelina hit on some great points on skincare. It's interesting. Patients come in and think that they're going to get a one-stop shop quick fix, and that's not the answer when it comes to the surgical arena and what I do. You can't just take 20 years away from the patient in one quick treatment or one skincare program or one laser treatment. This is a commitment. And I tell patients all the time that it's a three-way street. I commit to them surgically, they commit to me financially, but there's one more street that they have to take, and that is their commitment to themselves. And that involves multiple things, and that's being emotionally stable and doing this for the right reasons. Most of the patients today that come in are doing it for the right reason. They come in and they feel very young and vibrant on the inside, but they don't necessarily look that on the outside. That's number one. And then number two is they need to be committed to the maintenance of skincare, because at the end of the day, skincare can't take you back 25 or 30 years, but what it can do instantly is start preventing the aging process. So I kind of work with patients on that idea and that concept. And then lastly, when they do have a surgical procedure such as facelifting, laser or chemical peels, etc., I know that I can erase some of the time, but we have to get their skin ready for that surgery, so pre-treatment. And then if I do erase some of that time out, let's say I can get rid of 10 or 15 years of aging with a CO2 laser skin resurfacing, they then have to maintain that time that I've erased with good skincare treatment. And then they can start the aging process again, but 15 years earlier. So at the end of the day, all of this works together in kind of a one-stop shop for patients to get the very best results. They have to be willing to jump into this in all three facets of the surgical approach.
Dr. Michael's point of view, I feel like patients forget that skin, when you're treating skin is an organ. It's what the largest organ of our body, right? And they should be taking care of the skin as much as they take care of, the liver or the heart. When they think about it from that angle, I think it's a different conversation. And I love the concept of integrative, aesthetic practice, where it's the treatment modalities, the new technologies when it comes to laser, radio frequency, and then complemented by topical skin, because, we bring in the best of both worlds together. I feel like it's never too young to start, even on preventive therapies, because the minute we are born, we start aging. Clearly, we produce collagen, but the collagen production declines with age. We produce less collagen, and it also gets degraded. So we gotta supplement not only with obviously, skincare, but also topical, ingestibles as well. So it's more integrated approach than just, going to see a esthetician or plastic surgeon and dermatologist. It's very comprehensive and it's very integral, I guess, right?
I agree with that as well. And it's funny, you say some things that I say to my patients on a regular basis. Maybe it's the Polish in you, huh?
Very possible.
Yeah, because I got the Polish in me too. But that being said, you have to, when I approach patients, I tell them that there's many different facets of the aging process. I mean, there's after the age of 30, the bones of the face start to shrink, and the fat in the face tends to atrophy or go away. And you think about that is a structural volume change. And the hanger for the facial clothing, the big organ, the skin, is getting too small and the skin starts to set. That combined with both dynamic and adynamic rhytids or wrinkles, dynamic being those of action, making concentrated looks and smiling and laughing, those things age the face. And then there's adynamic changes that happen with the skin as well. And those are primarily from sun damage and environmental pollutants, smoking, etc. So we have to address all of those. And for example, patients that are smokers that are coming in for facelifts, unless they're willing to quit smoking for 6 weeks before and 6 weeks after, I don't even offer facelift procedures to them, because it's high risk for there to be complications, and the results are never as good as those patients who take care of themselves and do not smoke. So there's a lot of factors involved in this. And getting back to the psychological side of it, it's interesting that most patients today, and I said this before, they feel a lot younger. I think the aging process, a 54-year-old is not as old as a 54-year-old was 50 years ago. And the 54-year-old today is essentially the new 40-year-old. So these patients are vibrant, they're working out, a lot of them are eating well and taking care of themselves. But when you do that and you lose this, you're in the best shape of your life, you don't have any facial volume. And when you don't have facial volume, that's when the real signs of aging set in. So things like facelifts combined with fat grafting or fillers and things like that to maintain that volume is where you can really conquer this aging process and flip that switch of them not feeling comfortable about themselves. So in my experience now, I have pivoted a little bit on my thinking after being in the business for 25 years and having the true hyaluronic acid fillers, the HA fillers that are available today since about 2004. These fillers, there are many studies out there showing that fillers are starting to stay around longer than you think. They move a little bit and they change the collagen in that specific area, and they stay around longer than you think. And what I've found is that patients over the age of 45 or so, give or take 5 years, that are getting injectables by providers who don't necessarily know everything that we are talking about today. What's happening is you're getting filler face. And filler face is the telltale sign of being over-injected and the wrong things being treated because it's trendy, such as trying to create a jawline, etc., in somebody who maybe that's not their problem. And so what I've found is that over the age of 45 to 50 years old, these patients do so much better with face lifting, deep plane facelifts, and then volume restoration using their own fat. We have great options today with volume restoration, fat grafting, using things such as LipoCube, which allow us to slice the fat down into smaller and smaller sizes, put it at multi-planar approach, and encourage stem cell growth, plus or minus the combination of platelet-derived growth factors and exosomes to further enhance that stem cell proliferation. So at the end of the day, facial surgery in my hands and patients over the age of 50 is going to be the mainstay. Fillers can then be added after, let's say that they had a facelift today and they come back a year and want a little touch up, then fillers can be used again. But using fillers over just as a single approach after the age of 45, I do not recommend for patients. So for me, maintenance moving forward after they've had a surgical intervention is paramount. Number one, skincare. They have to wash, they have to exfoliate, they have to increase rapid cell turnover, such as the use of retinols, and then obviously sun protect. That's number one. Number two then becomes, what are the things that can help me maintain the look of my skin? So externally, that's going to be products where, like, you have microneedling with radiofrequency, plus or minus light CO2 laser resurfacing. I use a lot Renuvion, which is helium-based plasma with radiofrequency internally when I'm doing my facelifts, which promotes collagen thickness and tightening of the collagen, making it more laminar. And then you can do anything that's going to help stimulate collagen down the road through skincare and chemical peels for a maintenance approach.
What is the best way to recommend them before the treatment, during the treatment, or after the treatment?
So like laser, radiofrequency, PRP, you name it, that we have options that like the generation prior didn't have. So I feel like, yes, we'll live longer, and we also looking better because the 45-year-old a generation ago probably, look a little bit different. So I'm happy to hear that. When it comes to skincare solutions, my product line is used mostly by estheticians in treatment room as part of the back bar or like treatment protocols. And I think the most important thing is to realize that over 50% of population, especially in the United States, identify themselves as sensitive skin. At some point in life, their skin is either irritated or there's some kind of contraindication to adverse reaction to some kind of a topical that they were on in the past. That's sometimes even the case is with retinols, because retinol can be aggravated unless it's delivered in a special either liposomal system or being sandwiched with like hydrators and moisturizers. So I feel like the most important thing is to pick a skincare regimen that you stick to, because as a patient, as a consumer, I think compliance is key. You will not see a difference if you use products on and off. So you have to select a line that you as a physician feel comfortable recommending to your patients, but also you, patient, like the formulas that are being recommended to you. So compliance is always the key. And when it comes to, skincare essentials, I'm a fan of minimalism. You always need a cleanser, because you gotta take the debris, out of your face and prepare the canvas for the treatment product. So you definitely need a gentle cleanser that will not strip oil of your skin barrier, right? It will not make your face look very tight. It will just, effectively cleanse, but do it gently. And then you need a moisturizer. because you want to block hydration in, but you usually lose throughout the day. Even after showering, a lot of dermatologists right now are recommending to apply moisturizer on a damp skin just to lock that moisture in. So you can have occlusive moisturizers, you can have hydrators like hyaluronic acid, you can have hydrating agents, and you can definitely look for hydrating products that are like multitasking in nature. Some of those hydrating products also have active ingredients in them to help the aging process. So I can talk about it, in great details, especially when it comes to like topical skin solutions. But if I had to recommend a minimum skin regimen, it would be always a cleanser, moisturizer, and a sunscreen. And especially, of the case of the patients that you kind of, draw the persona for us, she's 52 and she was diagnosed with skin cancer. So prevention obviously is key. You do have to use a broad spectrum sunscreen. I'm personally a fan of mineral sunscreens. will not find me put a chemical sunscreen on my face, but I might be biased. I just love mineral sunscreens. They reflect UV light. In the United States, the FDA approves titanium oxide or zinc oxide based sunscreen when it comes to mineral solutions. You can find them, at your local pharmacy. You can find them from medical grade skincare lines. They are all wonderful. The medical grade, professional grade skincare lines tend to be blending sunscreens with antioxidants for like additional UV protection. So if you can afford it, I would definitely go that route. There's so many, there's a plethora of brands that are doing a great job with sunscreens, and some technologies are coming actually from Europe. So when it comes to basic skin regimen, cleanser, moisturizer, sunscreen. And then to tackle, unique skin concerns, I would add a treatment product, and it's usually a serum, because serum are known to pack a lot of actives in a small container. They are more potent by nature, and you can find anything from vitamin A serums, which is a broad spectrum antioxidant. It can help with skin brightness and discoloration. It's also a pro-collagen. It's a collagen cofactor. Vitamin A, especially ascorbic acid, acts as a collagen cofactor. It's also an antioxidant, right? So it helps with the fight the free radical damage. So that's one. You can also look for like vitamin A serum, that kind of a solution, which will help skin cell turnover, which Dr. Michael was speaking to. It will also help with, making the dermis a little bit thicker. There's clinical studies on that to prove that vitamin A acts like that in skin, and also helps texture. So if you have a rough texture, applying vitamin A, depending on the strength level, if you get a tretinoin, which is a prescription strength level, you can almost see like little flaking and peeling of the skin. You definitely see this, cell exclamation going on. So that's the basic. But when it comes to topical skin, obviously, that's my brand I'm the most familiar with. There's a lot of solutions within the line that I would recommend the Facelift patient to go on. Obviously, we have a cleanser. It's a gentle, hydrating cleanser. What's unique about it, it has oleosomes in it, which I identify to be an amazing delivery system / hydrating agent that kind of bursts on skin and delivers hydration throughout the day. Again, it's very efficacious. It will not disturb your skin barrier. I've added a little bit of like lemon essential oil extract, because when you're washing your face, especially in the morning, it has like this invigorating scent, so it will help wake you up. I personally need like a little pick-me-up, especially in the morning. And it lathers, so it's more like rich and luxurious, and has a lot of amazing ingredients, because again, you can never have enough of goodness to put on your skin. So ceramides to help the skin barrier reinforcement. There is soothing moisturizing agents such as allantoin. There is red algae, gotu kola, a lot of herbs. There's glycerin, and cholesterol, because I think my entire line is all about supporting the skin barrier and the hydration of the skin barrier. I feel like that's the kind of like the foundation. And then if you were looking at a treatment product, I have a very, very nice serum. It's called age-defying peptide serum. It doesn't have any fragrance to it, but if you smell a little bit of like botanical smell, that's what it is. It's just packed with a lot of extracts, traditional Chinese medicine ingredients. There's oleosomes in there too to help hydration. The usual suspects such as, hyaluronic acid, but it's in sodium hyaluronate format, which is more bioavailable humectant. And this particular product also acts to counter glycation process in your skin. So it has a lot of peptides that are anti-glycation in nature, other ingredients that will help, skin prevent, glycation from happening, or at least stopping it in the tracks. And then when it comes to, finishing up your skin regimen, I have to talk about the moisturizer, because we all can benefit from having a nice moisturizer in our skincare regimen, depending doesn't matter of your age, you do need to, add hydration to your skin. And topical skin rejuvenating moisturizer has niacinamide, peptide, vitamins. Again, it's very, very robust, comprehensive moisturizer with a lot of hydrating agents. So if your skin maybe doesn't respond well to, let's say, squalane, there is glycerin in it. If your skin prefers hydration from hyaluronic acid, there's hyaluronic acid in it. So I would recommend people to look at it.
The question is if you recommend to do that for skin type 4 or 5.
For skin type 4 or 5, that's an excellent question. There are a few lasers out there that you can gently treat skin types 4 and 5. That being said, it's very difficult to predict how someone's going to respond post CO2 laser. And as we move up this Fitzpatrick scale in skin types 1, 2, 3, 4, 5, 6, once you get past 3, it's very unpredictable whether they're going to get hyper or hypopigmentation following CO2 laser skin resurfacing. So, with that said, one caveat too, most people over a Fitzpatrick 3 don't necessarily need CO2 laser skin resurfacing like somebody who's a Fitzpatrick 1 and 2. And the reason is they have had usually some great pigment that protects their skin from the harmful UVA and UVB rays of the sun. So many times patients who have a darker ethnicity, they don't have the fine lines and wrinkles or what we call rhytids. A person who is of fair skin or English, Irish heritage, Norwegian heritage, where that skin just could not protect itself over the years from the sun. So in my hands, I normally don't treat anybody over a Fitzpatrick 3 with a CO2 laser. There are other ways to do that with microneedling RF, which has been shown to be able to be used through those different skin types, as well as light chemical peels.
And what is the difference to do microneedling with exosome with growth factor or without growth factor?
Me being classically trained and drinking the Kool-Aid of the industry, and then I can provide you an answer as, my personal answer as a consumer and doing research. So I love new technology and innovation. You have to be really considered the source of exosomes and growth factors. I think there is a split opinion when it comes to growth factor, and there's lines out there between Skin Medica and Eucurids that do believe in growth factors, and there's a lot of physicians recommending them, but there's a portion of scientific community that is speaking against growth factor, because in terms of your patient profile that you just put in front of us, she was diagnosed with a skin cancer. Now, let's say you put a growth factor topically on your skin. The growth factor, role is to help growth or proliferation of cells. What if you have cancerous cells in your skin and now you're helping those cells grow? For me, it's a red flag. So I try to steer away from ingredients that I find controversial. I rather find alternate route, or at least wait a decade for really science to prove for itself, to be honest with you. Even though I work in the aesthetic and medical field, I'm very, careful what I try and put on my face. And I think it must be this French allure of beauty where, I approach aging, how would I say it? Baby steps. I'm a believer in maintenance therapy rather than, going for the fabs and the latest trend. But again, I'm not a physician, so this is just my own personal opinions.
I think Ewelina made a really good point on the growth factors and the potential for growth factor to stimulate something that you don't want, right? So with skin cancer cells, etc. Skin cancer first. In general, outside of melanoma, squamous cell or basal cell skin cancers you've had present in situ for 15 to 20 years prior to seeing that the growth of that lesion, whatever it may be. So most of us get that because of severe sun damage on the front end. And most patients who present with a skin cancer have acquired 80% of their entire sun damage before the age of 18. Because when you're 18 and younger, you're not putting sunblock on, you're trying to get tan and you're out in the sun and you're invincible, right? I again, like what Ewelina is saying about skincare and it being natural, it being clean. I do believe in vitamin C for your skin. I think it's very, very important. I'm a retinol fan, but not too much retinol. okay, because that can be counterproductive. When you look at some of the skincare lines today, a perfect example that comes to mind all the time for me is Obagi. Obagi's skincare line was one of the best skincare lines ever made. And it's a very aggressive line, and it's a line that it's not a maintenance line. It's a come in, do something to your skin, get it in better shape line, and then transition into something else line. Skin Medica, I think, has some really good products. I'm a Skin Medica fan, but they do have the growth factor derived products. Again, you bring up a really, really good point, especially if you're going to be microneedling in products that can help accentuate any precancerous cells that may be there. So interesting concepts, and probably yet to be determined based on science and some of the data that comes down the road with these growth factors.
How was your expectation to be here today? And tell me a little bit how do you feel? How do you feel with this network?
I mean, I love being surrounded by like-minded individuals in this space and having different, perspective and hearing different, angles. So I had no expectations. I've been on the other end, but I always love collaborating, especially with physicians, because I feel like physicians have the authority to speak on the topic of science, skin. They went through extensive training. So, let's hear it from the horse's mouth, as I said, not from, the influencers, not from the social media, even beauty editors. We usually go directly to the source, which is a physician, to validate what they are hearing from other sources. So I love the fact that you're bringing a gamut of experts to almost like a webinar panel in a sense, and provide, share the expertise and share the pearls.
If I didn't enjoy this venue, so to speak, I wouldn't be here, right? And this is, I think, our third or fourth one, right?
Yes.
Yeah. So I really do. I think you're doing a great job. I like your angle and where you're coming from. I like that we're bringing international type ideas, concepts, skincare, etc., to the forefront instead of just relying on what's in the U.S. Because many times, guys, the U.S. is very, very behind, to say the least, in multiple things. And again, I like collaborating with new people as well, such as Ewelina. I think that it would be great to sit and talk with you and come up with some different ideas. I'd love to try your skincare line too. I think it's important for us to help each other.